Thank you, Mr. Chairman, and thank you to our witnesses. House Republicans have once again brought us here to discuss healthcare affordability, an important topic for people across the country and certainly at home in my district. But this hearing is really looking to shift the blame from this Congress and this administration for the healthcare affordability crisis that we're experiencing. And certainly there are a lot of important drivers, but as many of my colleagues have already said today, we cannot have any discussion about healthcare affordability without acknowledging that over the last year, this Congress has voted time and again, and it is Republicans in this Congress who have cast vote after vote to increase healthcare costs in the so-called One Big Beautiful bill that cut Medicaid, and in turn, because the cuts were so big, cut Medicare too, and by failing to extend the Affordable Care Act's enhanced premium tax credits. For an administration that says it wants to make America healthy again, its actions demonstrate the opposite. And my home state of Texas already has the highest uninsured rate in the country, and because of this Congress's actions over the last year at the urging of the Trump administration, that number is estimated to go up, not down. Now, I have the privilege of representing so many people who work at the Texas Medical Center, the largest medical complex in the world. And I also get to work with incredible people in our community who are working at federally qualified health clinics and other locations providing incredible care. And I'm so grateful to hear from all of them frequently about the many issues that they face in trying to care for their patients, including the strain that increased uninsured rates will add to the whole healthcare system. I mean, it's really an ecosystem. And so when we talk about cuts here and changes there, it affects everything else. And we know that these changes to the healthcare system and these increased burdens are forcing hospitals and providers to cut services and reduce staff. And we're only a few months into 2026. We've already started to see drastic losses. The Bureau of Labor Statistics reported in February 28,000 people lost their healthcare jobs nationwide, including some in my district. So we've covered a lot of issues here today, but there are other things happening in our hospitals that are also impacting access to care and to the health of our communities that we in Congress cannot continue to ignore. In fact, they arise not from the main topics that we have covered today, but from other policy decisions in Washington, including the Trump administration's immigration policies. We just heard about the nursing shortage. President Trump instituted a new $100,000 fee for H-1B visas, which are the visas that many healthcare workers rely on. This policy is gonna make it harder, not easier, to get a robust healthcare workforce. But I want to focus with the time that I have left on another. The Trump administration has ended a long-standing policy that prevented immigration enforcement actions in sensitive areas, including hospitals. And since this new rule has been implemented, healthcare professionals have reported an influx of immigration enforcement agents in hospitals, and that the presence of these agents roaming the hospitals has left many people scared to go there. And recently, federal health officials agreed to give immigration enforcement officials access to a Medicaid database that includes enrollees' addresses and citizenship status. And despite a court challenge, the courts are allowing this policy to move forward, and that is creating fear in our immigrant communities. And in cities like mine, where 1 in 4 people was born in a foreign country, in districts like mine, where that number is 1 in 3, this has a huge impact on people's ability to access health care. And this includes legal immigrants who are getting swept up in this mess of immigration enforcement that this administration is pursuing. And so I'm stating the obvious here, but if people are too afraid to go to the hospital because of immigration policies like these, they will not go, or they will delay going until they absolutely have to, when their conditions are worse, and in sometimes when it's too late. And so, we saw that during the COVID-19 pandemic. We saw the disastrous impacts when patients did not delay access to care. And so I trust that all of you would agree that delayed care often results in increased costs of care as well. And I want to ask questions, but I've only got 7 seconds left, so I'm going to ask them for the record. But what I want to know is from each of you hearing about what happens when a patient is forced to delay care for themselves, and what are the impacts on the overall health in our communities when we're delaying access to care for patients. Mr. Chairman, thank you for letting me go a second over my time, and I yield back.